developed all these birthing better skills in the early 1970s. We focused first on coping, managing, and handling the natural occurring pain of labor because at that point, 95% of women were having a labor and a vaginal birth. Whether there was a good outcome, whether women coped or not, there just wasn't the technical ability of the modern medical profession to assess risks or to handle them. So cesareans, 4.5% in 1970, were done only at the risk of the mother's life. And what we discovered after we developed those skills was we had to learn to prepare our pregnant body. We needed to get our babies down through our bony pelvis. We needed our cervix to open. And then that final passage, our birth canal, we needed to deal with. And I'll tell you, this really deals with our feelings about our own bodies and privacy and all sorts of things. You got to get in there and soften the tissue of your vagina or your baby's birth canal. Your baby is the size of a grapefruit that's coming down through you. And if the tissue and the muscles inside are tight, it can delay it. You can tear. You can be damaged by peeing every time you cough or run for the rest of your life. It's such an important skill. We got over our yuck. We just did. Even women who've had sexual uncomfortable experiences got over it because we pee down there, we poop down there, we get our periods down there, we get vaginal infections, we have sex. We have all sorts of things that go on down there, and birth is not the same as sexual problems. It's birth. It's the birth of our baby. So this audio is going to teach your partner how to do it. Over 85% of birthing better fathers do because it shifts them from seeing you as a sexual, intimate relationship to being the father of their child and you being the mother, and how they can help prevent a delay or damage or trauma to you or their baby. And you can learn to do it yourself as well. It's not hard. 5 minutes a day from 32 weeks. What's the difference? Hard to explain, but the ultra-Orthodox Jewish women who do this simply call it their homework. They say they don't like it at first. Within 2 weeks, the tissue begins to soften, and they know at birth they have done their homework well. So it's really, really important lesson. This is one of the great lessons in birthing better and one of the great skills. So do it. Bye.